My name is Dr. Hancock, and I'm an endocrinologist. I've been an endocrinologist for approximately 17 years. One topic I'd like to discuss today would be thyroid disease. Thyroid disease is very common, especially in females. However, men, we can get it as well. There's two major types of thyroid dysfunction. One is called hypothyroidism. The thyroid gland sits here in your neck. If the thyroid gland does not make and release enough thyroid hormone, you become hypothyroid. And those symptoms include fatigue, constipation, dry skin, weight gain, hair loss, cold all the time. Those symptoms, unfortunately, are very nonspecific, but if you see your healthcare provider and get the right test done, then we can diagnose that and treat that appropriately. And it's an easy disease, easy diagnosis to make. Pretty much the exact opposite of that is going to be hyperthyroidism, where the thyroid gland makes too much thyroid hormone. One of the most common causes of hyperthyroidism is a condition called Graves' disease. What I found very interesting about Graves' disease is former President Bush, George Bush the first, not George W., but George Bush the father, he had Graves' disease, as well as Mrs. Bush, Barbara Bush. They both had Graves' disease. Graves' disease is an autoimmune thyroid condition. Autoimmune means your body makes antibodies that attack the thyroid gland. These antibodies cause the thyroid gland to grow, as well as make and release too much thyroid hormone. If you get too much thyroid hormone in the bloodstream, you get symptoms such as heart beating real fast, or what we call palpitations. It may start to sweat a lot. It may get unexplained weight loss. It may get nervous or anxious, as well as a really big thyroid gland. And in some patients that have Graves' disease, they have blurred vision and double vision, where your eyes kind of bulge out, so to speak. If you get Graves' disease or any other form of hyperthyroidism, this can also be diagnosed fairly easily with blood tests as well as x-rays. The most common way we treat Graves' disease in this country is by a small radioactive pill. The other therapies, we can treat you with medications as well as surgery, but the most common way we treat it in this country is going to be a small dose of radiation. Just like with hypothyroidism, it's an easy diagnosis to treat, easy diagnosis to make, as well as the treatment is also fairly easy as well. What I recommend you do is, if you have either one of these symptoms, make sure you see your primary healthcare provider and ask him or her to refer you to an endocrinologist, because these are conditions that we see and treat every day.